And then our immune system just goes a little haywire and starts to attack ourself. That's what an autoimmune disease is. Hi there, it's Julie Murphy. I'm a women's health nurse practitioner at Forum Health in Tampa. Today I just wanted to talk a little bit about autoimmune disease. Autoimmune diseases have been on the rise for at least the last 30 years. There's really been a significant increase in the Western societies, and I think there's now over 100 different autoimmune diseases. The growing attention really has been on environmental factors, in particular kind of what's happening in the Western lifestyles. So there's been significant changes in the Western dietary habits, kind of that standard American diet, environmental surroundings and pollution exposure, infectious habitats, as well as our increasing stress load. Much of conventional medicine really is looking at relieving pain or symptoms that people experience when they have an autoimmune disease. Almost think about it like jailing the immune system. So functional medicine really offers a different approach or a different alternative other than just, taking care of the symptoms. We're really trying to address the underlying mechanisms that cause autoimmunity, and we try to really prevent and in some cases really reverse autoimmune disease. One of the big things that we have to do is recognize the role of the gut in developing autoimmune diseases. When we think about leaky gut or junction of the gut that's supposed to be nice and tight starts to become leaky, we call that gut permeability or leaky gut. What that does is that allows things to get through that gut barrier that generally shouldn't, and that's what starts to flare our immune system. A big thing is fixing that gut permeability and looking at that gut balance, kind of the good, the bad bacteria, and getting it back into a good balance can help. So what happens is we have a genetic predisposition to having autoimmunity. So we might have family members that have autoimmune disease. And then we have triggers. And those triggers, along with that damage in the gut lining, is what kind of precipitates or makes that autoimmune disease happen. One of the fixes outside of doing the gut is also looking at the trigger. So, we need to remove those triggers. So common triggers can be food. So 70% of all autoimmune diseases are triggered by gluten. The other main trigger can be stress. And then other triggers might be other toxins or infections that are triggering this autoimmune issue. Food and lifestyle are not enough from a functional perspective. We do use some herbal and other natural kind of immune modulators that can help sort of down-regulate that overactive immune system as well. So I hope that gives you a little bit of perspective as far as a functional approach versus a conventional approach when it comes to autoimmune disease. Thanks for listening. Bye-bye.
Hi, Dr. Saxena here, Chief Medical Officer at Forum Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.